Hey, this is Doug Field along with my co-host Ron Bachman, and welcome back to this segment of Healthcare Consumerism Radio. We're pleased to have joining us today Yale Miller, who's Executive Vice President of Aegis Health Group, and Aegis is really focused on working with the hospitals and the changing world that hospitals are facing right now. And Yale, good to have you in the program.
Good morning, Doug. Thank you for having us on today.
Yeah, how's things in Nashville today?
Things are great in Nashville. Spring has finally sprung, and hopefully people are getting active and getting healthy, utilizing taking advantage of the good weather we have out there, right?
Yeah, you got it. There you go. Well, listen, talk to us about what your work with hospitals and this new white paper that you've come up with, Population Health 2.0, the Age of the Consumer.
Sure. That's a white paper that we published earlier this year, really focusing on what's, as we say, 2.0, what's the difference this time around or in this age, and kind of how have we gotten to where we are now. And certainly feel like when we talk about healthcare consumerism, a decade ago or half a decade ago, it really seemed like consumers are out there on their own. They say consumerism, here's your high-deductible health plan, go make some choices. Yeah. And that's really changed in terms of, I think, all the parties coming together, all the interested parties, and by that I mean the plan sponsor, which is still primarily the employer, investing in tools to help consumers make better decisions, plan design for those individuals, excuse me, and certainly the healthcare providers, more and more consolidated systems who are beginning to take a very serious interest in helping improve the health of communities and individual populations within those communities, particularly focusing on employer groups, because that's where plan sponsorship begins. Excuse me, and where people are used to finding things like wellness programming, health management, and those kinds of things.
Yale, Ron Bachman here. Just so be sure the audience is clear, tell us a little bit about your business model, who your clients, what are the products and services you're selling. I think you're hitting all the right tunes from the things we like to hear about healthcare consumerism and more engaged, consumers and patients out there. But what is it that you're really selling and promoting, and to whom?
Good morning, Ron. I'll tell you just a little bit about Aegis, and we've been around for 25 years, and our clients are hospitals and health systems. We work with for-profit, not-for-profit academic medical centers all over the country, and our clients have traditionally been those who recognize that they want to take a leadership role in their local community, and instead of being seen just as the reason healthcare costs are going through the roof and rising exponentially, to change that dynamic and begin to have a conversation directly with the people they serve. And I put that in two buckets. One is their customer, and that's largely the employer. They're the ones ultimately paying the bill, whether they're self-funded or whether they're underwriting the cost of the insurance premium for their employees. And then two, who's our end user? Who are those customers that we're trying to serve, and do they become customers when they become patients, or is there an opportunity for us to step outside the walls and try to engage people proactively and begin to move them into some sort of a health management, whether it's something as simple as an educational seminar or actively engaging them in screenings and follow-up and health coaching, ultimately, as your last guest said, tying that into that physician-patient relationship, particularly as we move to an environment where we have more patients, more insured patients seeking care, not as many physicians. How do we extend that care, and then utilizing information technology available to us, create a meaningful pathway back so we don't have any gaps in information or gaps in care as we move into the more traditional healthcare setting. With that is go ahead. I apologize.
No, I was going to say a lot of people hear the words population health management, but healthcare consumerism, in many ways, people think about my own personal responsibility, my own individual engagement, getting health literate on various choices and options and conveniences. Tell us about how you take the population management where a hospital is trying to reach out to the community, many of which may not be insured, many of which may have insurance contracts that direct them to other hospitals. How do you take the population management and then bring it down to the individual citizen out there and get them engaged in these consumerism activities?
Well, I think there are a variety of ways. We tend to focus on that employer and provider engagement platform, and what the Affordable Care Act, the ACA, has been great in that regard, in that while it stripped away a lot of things from the insurer's perspective in terms of lifetime limits, annual limits, pre-existing condition limitations, those kinds of things, it really gave some powerful tools to employers to begin to, put in place some monetary levers, whether they're using carrots or sticks, to help move people toward better education, better health literacy, and making better decisions about how they spend their health care dollars and how they make decisions in their daily life to tie that into the impact on their health on a day-to-day basis and long-term as well. So I think beyond that, we see hospitals and health systems, again, driven by ACA, moving pretty rapidly into some different care models. I was talking with a hospital client on the West Coast last week who said, independent of any legislation that's out there, we looked at the model, which just said our expenses are increasing. What we're being paid is reducing, and that trend's not going to change anytime soon. So we just have to create a new model. And that new model is, let's go out, let's engage people before they ever come to see us and begin talking with them in their terms. And a lot of that can be around how do we get to them? It's community-based events. It's hospital-based events. It's certainly we can do some things through traditional media, but it's much more coming down to things like social media and really utilizing things that are available to us through internet and mobile technology. We see a lot of hospitals and health systems going the route of creating custom-branded health portals. So a place that individual consumers can go in and typically through some sort of onboarding process that includes a health risk assessment of some sort, probably some sort of biometrics that they can access through programs that the hospital set up, whether community-based or employer. And then they have a resource they can go and find information about their unique health risk based on those inputs that they've given, track metrics such as weight, cholesterol, blood pressure, et cetera. So it begins to empower them a little bit, not only in terms of making a time investment in their own health, but also giving them some feedback, one, about what their daily decisions mean to their health, and two, what are the local resources that are available to them and at what cost? And many times there are community-based resources that can help people move in the right direction pretty quickly at low cost.
So in essence, we talk about this a lot. You're helping health systems and hospitals, turn from a sick care model into more of a well care model.
That's right.
Yeah. And what are some of the hurdles? You've talked about some of the progressive ones that are taking that step forward. What are some of the hurdles getting some of the other health systems and hospitals to move forward?
Well, I think like anything, sometimes it's fear of the unknown. Yeah. What lies beyond, and what's the pathway to get there? We use the analogy a lot of 1 foot on the dock and 1 foot in the boat. Yeah. And how do we move from volume to value without, splashing in the water somewhere along the way? And I think it's tricky, and it really takes collaboration. I think it takes collaboration and not one of those pieces that we mentioned earlier in terms of payer, plan sponsor, employer, and ultimately consumer can do it independently. We've got to move together to get out there. And it's eating the elephant. It's one bite at a time. Let's have a plan, and let's step through that to begin to empower consumers to make decisions. I think those healthcare providers who are the first to use the word transparency, but able to get out to consumers cost, quality, outcomes data in a way that they can understand it, are going to be ahead of the game. So I think it's a lot of it comes down to how does an organization transform itself from what it's fundamentally been to something that's effectively 180 degrees different. And you see a lot of health providers, health systems, bringing in outside folks. Then they say, we're great at the bricks and mortar stuff. Once they come inside the walls or see our physician, we're good. But we're not real sure how to go into the community or go into an employer and engage people meaningfully in health coaching that has positive outcomes, et cetera. So they're seeking outside counsel to help them get there.
Yeah, that's the interesting, though. We've got about a minute or so to go, and I want to give you an opportunity really to wrap this up and give our audience some clear takeaways, and then tell them how they can get in touch with you, please.
Well, we appreciate that. And I'll tell you, excuse me, we are the Aegis Group. If you'd like to learn more and download our Population Health 2.0, The Age of the Consumer, is the name of our white paper. It's at www.aegisgroup.com. There's a population health management page there, and with a quick click, you can download that white paper, which has some really good statistics, trends, et cetera, and some good case studies from some different health systems who are Aegis clients out there. And really, our big push is toward that consumer engagement. We've developed our own portal, as we mentioned earlier, called One Community. If you go to infrontofwhat'sahead.com, you will see some interactive pieces around that One Community population health portal that I think people will find engaging, intuitive, easy to use, and so forth.
Yeah, listen, I really appreciate you joining us today, and urge our audience to check out your white papers. And Yale, if you can make it down, we'd love to have you down with us at Forum here in Atlanta, May 7th through 9th. I think you'd find the discussion very synergistic around some of these topics that you're focused on.
Thank you for that. I just pulled up your agenda, and it looks really good. I'm going to try to move a couple things so we can be there.
Okay. Listen, have a great weekend. I appreciate you being on the program. And to our audience, stay tuned for the next segment of Healthcare Consumerism Radio.